great growing up. We had our struggles, unlike any other urban community. But growing up, it was, I never imagined that my children would, I always wanted children. I just never imagined that they wouldn't be in Flint, working in Flint, prospering in Flint, because we seen prosperity around everywhere we turn when I was growing up. So this is what my normal was.
Flint is a community with history, built on work, family, and pride. And for many residents, the story isn't just what happened, it's what they've lived with ever since.
On April 25, 2014, Flint switched its water source to the Flint River. Without proper corrosion control, residents faced an increased risk of lead leaching from aging pipes.
I didn't really recognize them until I got into the schools, because you see the bald patches in children's hairs, and you see that families are really struggling to pay these astronomical water bills for water we still can't use. So for those who are saying the water is safe, that's not true. Absolutely not true.
Flint residents had long raised concerns about contaminants associated with the water crisis: lead, PFAS, and total trihalomethanes, TTHMS. Michigan Department of Health and Human Services says more research is needed to confirm causality of cancer. When a community is told to believe one thing and experiences something else, trust doesn't just crack, it collapses.
We have trust issues in Flint, not just the community that I'm speaking of, but myself also, because we've been told so many false narratives.
And over time, that broken trust turned into a bigger question: what does this mean for long-term health?
In 2021, the Michigan Department of Health and Human Services released a cancer incidence review looking at Flint from 2000 to 2018 compared to Genesee County and the state.
By 2022, public reporting amplified what many Flint families had already been saying. Concerns about cancer were rising.
It's going to take time, but unfortunately with that time, it'll come some trial and error. Is it more cancer cases? Is it more deaths? We don't know, because it's a high price to pay, right? It's not worth the risk. People don't want to gamble with their lives in there.
That's why this work matters now, because in communities like Flint, waiting is not a plan, and late detection is not acceptable. In the National Minority Quality Forum's own survey work, residents in and around Flint identified cancer as their top health concern, a direct call to action, not just observation. Early detection is one of the strongest tools we have, but too often underserved communities are diagnosed later because access is delayed, follow-up is slow, and care is harder to reach. That delay costs lives. The National Minority Quality Forum is working in Flint to shift the timeline earlier, toward cancer detection before symptoms, and toward care systems that respond faster when risk is high. That mission has a name: the Cancer Stage Shifting Initiative. CSSI exists to reduce cancer disparities by shifting detection earlier, before cancer becomes advanced and harder to treat. Part of that work is showing up now, bringing screening, education, and trusted health resources directly into the community so access doesn't depend on luck, time off work, or perfect transportation. This is also about the future of detection: multi-cancer early detection, tools designed to identify possible cancer signals from a blood draw, including cancers that don't have routine screening today. And for communities like Flint, the goal is not only earlier detection, it's changing how clinical care responds to environmental risk: earlier monitoring, faster evaluation, and fewer bottlenecks when time matters most.
Because Flint, once upon a time, was a great place, and my hope is it will be again one day.
Early detection is power, and prevention should be available everywhere, especially where risk has been ignored for too long. Today, we collectively say "I'm in" on life-saving research.